Good afternoon, everyone. Today we are announcing 88 new positive COVID-19 tests and 8 new additional deaths, 7 of them in long-term care. Our total COVID positive cases are now at 3,464. We have 335 people that have been hospitalized and a total of 159 deaths. A couple of other additional just quick updates on testing. You would have noticed yesterday that our numbers spiked pretty high in our testing numbers, and we are going to separate out those numbers going forward. I don't have updated numbers today, but you will notice yesterday we reported out a number of 3,700, approximately 3,700 tests. Of those, 823 of them were antibody tests. 2,882 of them were the PCR regular COVID tests. Both types of tests are very important in our response to COVID, but really when we look at our response, knowing the number of active infections is really, really important. So, since antibody tests have been out, the numbers of antibody tests that have been run in New Hampshire have been very minimal up until last week, under 100. So really didn't impact our numbers significantly. But since announcing our Clear Choice MD antibody testing initiative, really spiked those numbers. So we are going to start separating those numbers and should be as of today. We've been contacted by another urgent care center that wanted us to let everyone know that they are both doing PCR and active antibody testing. That is Express Med, which they have locations in Manchester and Salem. So that is more access to testing in a variety of settings and all across the geography of New Hampshire right now. And just as a new long-term care update, we have one new outbreak to report at Villa Crest Nursing Home in Manchester, who has positive COVID rates of 10 residents and 1 staff. And one to remove, which is the Community Resource for Justice Transitional Housing Program. That program closed earlier this week, so that exposure and that outbreak has closed. That's all I have today. Thank you.
Great. Well, thank you, Commissioner. I think I speak for everyone in my office when my jaw hit the floor when it was announced that we were doing over 2,500 tests in a day just on the PCR, never mind the antibody tests. So just to, I guess, a little bit answer Adam's question yesterday in terms of setting the next goal of testing, the team is just really knocking it out of the park across the state. Again, with more facilities opening up testing today, as well in Salem and Manchester with another partner. Express is just a great organization that's going to step up and offer that testing as well. So we anticipate the number to keep increasing across the state, which is going to be, again, just a very valuable tool in where we go and what we do. So today we want to really talk about a lot of the operations and the opportunities being created by GOFER, which is the Governor's Office for Emergency Relief and Recovery. A team of state officials that have been incredibly dedicated to finding areas of need and deploying rapid relief very fast for New Hampshire's 1.35 million people, making sure that we get it across a variety of sectors and a variety of needs in these very uncharted waters and very pressing times for both individuals and businesses. To date, the state has received approximately $1.25 billion in coronavirus relief funds within the CARES Act, as well as many other dollars outside of that $1.25 billion for programs like the Department of Justice, for hospitals and healthcare, all with the mission of helping combat and recover from COVID-19. The team at GOFER met day in and day out and continues to do so with key stakeholders led by Jerry Little, their director. Has been a terrific team, and it's been an absolute honor to spend some time with them and bounce ideas. And I've seen and watched them work with the Legislative Advisory Board, with the Stakeholder Advisory Boards, in terms of not just receiving information, but really figuring out not just how much should go out, but how, what tools and what methods would we use to make sure that whatever gets done is done quickly and fair and an open and transparent process. They've really allowed the state to get a broad perspective of where relief should be focused. Their mission was to move fast, and that's why we're here today. We are talking about an allocation of an additional $595 million in committed funds for affected areas and industries across the state. And before we go into what we're announcing today, I want to take a step back and we can talk just to give folks perspective about where we've committed funds so far. All of this refers to the $1.25 billion of fairly discretionary COVID funds. We have guidance we have to adhere to, but there's a lot of opportunity with those funds and spreading those dollars across the state in a variety of different ways. And in the first few weeks since receiving the funds from the federal government, approximately April 23rd or 24th, I believe, is when we were first given the guidance in terms of how the dollars could be spent. And while that seems like a long time ago, it was literally just about 3 weeks ago. It's pretty incredible. We moved very quickly. We committed about $250 million in federal funds to help those in need. Approximately $3 million was spent to support child protection efforts and victims of domestic violence. $24 million has been allocated to our first responders, $50 million to support our healthcare system, $75 million to support frontline workers in our in Medicaid-funded facilities, $50 million for state agencies for COVID costs that we anticipate won't likely be covered by FEMA, about $40 million to cities and towns for COVID cost reimbursements, and $8 million for oversight of federally mandated expenses. So that was just the first $250 million. It's an immense amount of money, but the fact that we're able to get it out in a variety of different areas, all of these programs have been discussed previously as part of these press conferences, and it's all the information and detailed information is available on the Gopher website. But obviously these steps were just the beginning. Every day we take steps and more to provide relief for those areas in need across the state. So we have some new commitments we're talking about today. And looking broadly over the state's new funding commitments, each sector we're investing in and providing relief came from the recommendation of the Bipartisan Legislative Advisory Committee. Earlier this week, that committee voted on and submitted a report and a summation of various programs they would like to see dollars allocated to, and that provided it to be a very useful tool. It was terrific to be able to not just hear how they went about their process, but get something that I think was very valuable, very tangible, and then allows us to move very, very quickly, break through a lot of the bureaucracy, and move quickly with a lot of the programs and opportunities. They came up with I think, a very solid foundation that we're discussing today. We're going to continue to expand funding for our hospitals, healthcare facilities. We are committing an unprecedented amount of money into our nonprofits, Main Street small businesses, investing in farmers and food supply systems, continuing to put dollars to work for childcare, frontline workers, and education systems. And we're going to take a few minutes and go through each of these line items. As you can see, the $595 million, believe it or not, totals up pretty quickly, but I think that's a very poignant number that accentuates the real need, and somewhere is just scratching the surface of the real need within the state and the dramatic effects the COVID-19 epidemic has had for our entire state. So the first area I want to talk about is hospitals and healthcare. And as a reminder, about 2 months ago, we established the Emergency Healthcare System Relief Fund. It was very innovative. We were the first state to do it, about a $50 million fund at the time that ensured that no healthcare system would close their doors amid the COVID-19 epidemic. Today, we're doubling that amount allocated for our healthcare organizations by increasing the emergency fund by another $50 million, bringing the total to $100, which will help facilities keep their lights on and provide critical services to those in need. We've always said one of the most important things we have to do is ensure the citizens that those doors will not be closed to them in their time of need, whether it's for a COVID-related issue or otherwise. We really need to stand behind a lot of these institutions, and we are happy to have the opportunity to do so. Of this new $50 million cash infusion, approximately $30 million will be set aside for long-term care facilities. So we're really carving out a good chunk of this money, as we have done also for hospitals, for long-term care facilities, because we now realize and understand, I think, that that is really where the crisis points are, where these outbreak points are. They not are only feeling the dramatic effects of COVID-19 from a healthcare perspective, but undoubtedly both short and long term from a financial perspective as well. And again, these are just the first steps. We want to make sure that they know and the citizens know that these facilities will have our support. The additional $20 million are just going to the hospitals and other healthcare needs. We've already distributed just shy of $30 million, I believe, of the original $50 million. And again, those dollars were designed to make sure no one's shutting their doors. So we created a team of 5 or 6 individuals. They created an independent team, an independent scoring system outside of our office, and really looked through all those different applications, hundreds of them, frankly, to figure out which facilities were in the most need, were maybe at risk of closing doors, prioritizing those, scoring those in a fair and open process, and then allocating the dollars out. And I believe somewhere between 60 and 70 organizations have now received funds, and with this new cash infusion, we undoubtedly know that more will have that opportunity. New Hampshire hospitals alone, we talk a lot about the hospital system, and we're able to really compile, because it's moving very, very quickly, not just here within the state, but at the federal level as well. And New Hampshire hospitals alone to date have received about $225 million of CARES Act funding outside of this $1.25 billion we're talking today. So this is funding that has come in. The federal government set up a $175 billion program to support hospitals and healthcare facilities, very similar to what we're doing. I guess we were spending CARES Act money before the CARES Act was, in a way. And that opportunity has allowed hundreds of millions of dollars to already come into the state. Approximately $285 million in total has come for hospitals and healthcare facilities. And about 40% or so of those funds out of the federal government have been spent. So the good news here is that with 60% to go and already almost $300 million in the door, I think it's a safe assumption that hundreds of millions of dollars are going to be available for hospital and healthcare facilities in New Hampshire, and that is great news. It really is. We see our job with this hospital and healthcare relief fund to make sure the doors are open. Federal government is stepping up to making sure that they have a lot of the cash that they need. And then down the road, we can always add into our program if the necessity is there. But in a way, it's an unlinked partnership, if you will, between the state and the federal government providing these resources for the healthcare facilities that are really facing a lot of the brunt of the COVID-19 crisis. As a reminder, knowing that all this money is coming in, this is the one area we said early on and the one area we stick to, where this is the one market sector where the state is truly guaranteeing that we don't believe any facility should have to close its doors because of the financial hardships brought on by COVID-19. That would be a tragedy for a lot of our communities, especially our rural communities that rely so much on these facilities. Today, we're also putting forward $60 million to New Hampshire nonprofits to help mitigate the critical public health and economic impacts of the crisis on residents who rely on these nonprofits for so many of their daily needs: food, shelter, healthcare, educational supports, and other human services. This funding will move in a streamlined, very rapid manner to help organizations across the state, from the arts to human services, the nonprofit community, development organizations, so many others. The program is not designed to cover healthcare nonprofits. They're covered in the other programs, one of which we just spoke about. Childcare nonprofits, we're creating a separate fund for childcare, which we're going to talk about very shortly. And higher education institutions, we have another fund separate for the higher education. Technically, those are all nonprofits, but we're really focusing these dollars on the other nonprofits. There's thousands of them across the state, frankly, that provide a lot of the foundation and the services that so many folks have come to rely on. And what I really like about this program is that this is going to be administered in a combination, a partnership, if you will, between the Community Development Finance Authority, we call it the CDFA here in New Hampshire, and that organization has traditionally very good about streamlining federal funds and financial opportunities to a very grassroots, localized level. The New Hampshire Charitable Foundation, which a lot of folks are aware of, again, providing over the years literally billions of dollars of support to nonprofits, so they have a great system in place to know exactly where those needs are and how to administer them. And the New Hampshire Center for Nonprofits, which helps manage and provide resources for those nonprofits, especially some of the smaller ones. So by having those three organizations all combined together, they came in and made I think a terrific proposal. It's exactly what the state needs. This is one of those areas where the original requested amount by the Legislative Advisory Board looked at $30 million. And a lot of one of my original ideas was to space out how this money was going to go. A little money today, a little money in a couple months, a little money down the road, always trying to manage where those needs might be. One area with nonprofits and businesses, we came to the real conclusion that the apex of need is now. It really is. We are taking steps to slowly open the economy and get things going. That's going to take some time, we know. But to be sure, the apex of need is today. And so instead of the $30 million that was originally proposed by the Legislative Advisory Board, I'm front-loading this to $60 million because the need clearly is today. And as we hit these summer months, as we hit the need where a lot of these programs really need not just to be stood up, but provide those services to children, to families, whatever it might be across the state, we want to make sure that we're supporting them. And I think this partnership with the Charitable Foundation, CDFA, and the Center for Nonprofits is a great tool, if you will, to get a lot of these resources going where they need to go. Childcare, another real critical issue. We've talked about since the day this crisis happened, since the day we went to remote learning, since the day that these anxieties hit our families and individuals, we knew that children were going to be one of the sectors on the front lines that could be impacted the most. Sometimes you don't see it. Sometimes it's behind closed doors. Sometimes it can happen in very subtle ways, but it can be incredibly impactful for those kids, whether you're talking about education, remote learning, all positive things in terms of being able to provide opportunities, and given that we had to make some tough decisions on schools. But it's a real change. It's a change to the system. And knowing that, we got a terrific proposal in a combination with the Department of Health and Human Services and the Department of Education coming together, providing a proposal that can really meet child care needs across the state as the economy reopens. We know that as businesses reopen, more adults and parents may have to go back to work, and we're going to have to be there to provide a variety of resources in terms of child care and support systems that surround that. We're committing $25 million to provide emergency funding to the early childhood care and education system to support our urgent child care and family support needs. It's a vital component to the plans to really get things moving, and the demands are shifting very, very quickly. So again, we wanted to be rapid with these funds. I don't remember, I think the Legislative Advisory Board might have recommended $20 million. Again, we're going, or I should say the Department of Health and Human Services recommended 20. We're going with the $25 million because undoubtedly, as we've seen in the past, there's always additional needs on the back end. And we just want to make sure that these programs are stood up. We're not shortcutting ourselves in any way. We have the financial ability to do that with the $1.25 billion that was granted to us from the federal government, and we want to put it to work as quickly as we can for these kids across the state. Next, we have the Main Street Relief Fund. This is a large fund. It is $400 million fund. It's a pretty staggering number at the state level, but when you consider the PPP program, a very important program, just injected well over $2 billion into the state for a lot of our businesses, and that just started to hit the surface. We know that the $400 million isn't necessarily going to cover all the bases, but what we are trying to do is make sure that in a fair, open, and very equitable way, businesses really have the opportunity to do the basic things, pay their bills, pay their mortgages, pay their property taxes, things of that nature, so that even if they are in a position where they have to close or have been closed, if they are in a position where they're having trouble getting workers getting back to work and they have to stay closed for a little longer, it's not driving them into a bankruptcy position. It's not driving them to fully close their business. It really is to provide that relief, not necessarily stimulus, that's a little different, but actually relief to help these businesses survive and recover, hopefully in a growing economy in the future. This initial round of $400 million will obviously help small business get through all these disruptions with COVID-19. And in order how to determine the size of need across New Hampshire, the state will require a pre-grant qualification form to be completed over the next 2 weeks. Starting today, businesses have 2 weeks to complete a very, very simplified form. We've tried to make this as easy and streamlined as we possibly can, and again, make sure it's when the elegance of making things simple also is that it can allow us to move the dollars very, very quickly in a fair and equitable manner. So starting today and ending on May 29th, 2020, small businesses interested in receiving funds have to fill out the pre-grant application through the Department of Revenue Administration. That's primarily the group that will be administering this, so we can verify all of the revenue amounts and the losses that we're asking businesses to attest to. We're working directly with our DRA, so we know that the auditing will be true, that we can minimize any fraud, waste, or abuse within the system. You can go to revenue.nh.gov, that's revenue.nh.gov, to get access to the application, or you can just go to the Gopher site as well, goferr.nh.gov. That's gopher.nh.gov. Will also allow you to access the pre-grant application. That application is really going to allow us to account for businesses' anticipated lost revenues due to COVID and any other federal assistance a business may have received, like through the federal Paycheck Protection Program or other federal programs that might be out there. And that allows us to really determine what the delta is. How much has this COVID-19 crisis really impacted the small businesses across our state? Any eligible business interested in applying for the funds has to fill out the pre-grant application. And after the 2-week period is over, the Department of Revenue Administration will look at the data and work in determining a final fair and simple formula that will guarantee any small business that qualifies. So anyone that qualifies will receive a check from the state. So one thing we're trying to avoid is a first come, first serve. That's not the situation here at all. If you qualify, you will get funds. We're trying to really streamline that process. If you're a small business, less than $20 million in revenue, you qualify for this program. So we've heard loud and clear from mayors and local officials across the state. We've been talking to them on a very regular basis, and they're concerned about things like property taxes, paying bills, foreclosures, all of that for all of their businesses and their citizens. And this is one way to ensure that the relief is there to pay those bills and make sure that and essentially a lot of this money gets reintroduced back into the economy. It isn't necessarily designed to be sitting in someone's pocket as savings. It's only businesses that have lost a significant amount of revenue. They can keep those businesses open, pay those bills, get their workers back to work, and again start slowly growing as we come out of the COVID-19 crisis from an economic standpoint. And instead of the numerous strings attached, the funding will empower small businesses owners to make decisions for themselves. Again, I just want to thank, this is another example where there was a good recommendation to focus on small businesses, specifically out of the Legislative Advisory Board. And again, we looked at maybe separating it out $100 million this month and $100 million down there and $100 million in a few months down the road. But boy, the need is really now. What we don't want to do is create a situation where we're holding on to dollars that could have been spent to help some of these small businesses in the thought that we'd spend it in September, October, but the businesses go out of business in July or May or June. So we came to the conclusion that contrary to what I originally wanted to do was spread it out, we really needed to kind of front end and fast track these dollars to get them exactly where they need. The good news also is that we know that there'll be some stimulus dollars likely coming. Probably not the $3 trillion we're all hearing about out of Washington today, but it's clearly a message bill that's being passed out of the House of Representatives. I think there'll be something coming, whether it's for state or businesses or infrastructure support. We've heard a lot of rumors out there, and I think those are all good opportunities to look at. But we feel confident that they'll again be potentially another round of funding out of the federal government that can help businesses really stimulate the economy. And again, given the amazing work that the team at Gopher has done, I'm sure they'll be up to the challenge of taking that up as well. Next, we have what we're calling our food and farm. We just have a slide here talking about. There we go. Slide talking about, again, Gopher NH and revenue.nh.gov. Again, those are the two sites that are up and running right now where you can get those pre-grant applications. Everyone has to fill one out. Very, very simple to do. And again, all administered through the Department of Revenue Administration, effectively our tax collector in the state, to help verify all the data is true and accurate. We have our farm and food program. So funding for our farm and food, our farms and our food, for farms and food. So we're investing, to start with, a total of $15 million, but $10 million specifically into the Department of Agriculture. One of the focuses there, I think the Department of Agriculture came forward and gave a terrific presentation, frankly, specifically highlighting the need of dairy farmers. We've heard of some of these dairy farms across the country and here in New Hampshire facing some hard times. We've heard of folks even dumping milk, things of that nature, because of transportation or cost issues, whatever it might be. We have a lot of them in the state, and we want to stand behind them. There's a few $1 million in there within the Department of Agriculture as well that will also stand up emergency grants to ensure stability in our food supply chain, again, on farms, other types of agricultural farms all across the state. And again, we have a great department, and Sean Jasper, who leads the Department of Agriculture, his team. They've done a terrific job over there, and allowing them to have some of the flexibility to really support our farmers across the state. My grandmother used to call it Cow Hampshire. So I don't know if we're still Cow Hampshire as we used to be, but we have a lot of farms across the state, a lot of food farm-to-table opportunities that will come down the road, and they just, at a very localized level, provide a lot of integral support and need for our families and our citizens. We're also looking at investing $5 million into the New Hampshire Food Bank. There's a huge need with the New Hampshire Food Bank given tough economic times, not just for themselves, but also supporting all the local food pantries across the state. So it's really an unprecedented amount of money, but there is an unprecedented need. And we want to ensure the citizens of New Hampshire the food bank is viable, it's stable, it's robust, it has opportunity that can be distributed out to the families. They do incredible work, and again, we just want to make sure they have the resources, and ultimately you, the citizens of New Hampshire, have the resources for what may come to bear. We're looking also at higher education. So we are committing $15 million to higher education in New Hampshire as well. We have $10 million. I just want to make a note of it. There's $10 million into the university system of New Hampshire for support. And that's primarily for things like to make sure the online learning programs are as robust and adequate as they need to be, make sure that there could be COVID testing or contact tracing for students or faculty, whatever the plans might be as they start designing their plans to get up and running. It's going to be very important to have the university system have those resources. So we're allocating $10 million to the university system and $5 million to the community college system. The other part of the community college system, they gave a great presentation on their support for the Back to Lab Learning program. Back to Lab Learning is really those in-person learning programs that have to happen, so they really need some funds to make sure that the students can truly get their degrees and get those certifications. We also have some stipend enhancements we want to talk about today. A final area that we're discussing does not require any additional dollars, but as a lot of folks know, we created opportunities specifically for the nurses in Medicaid-based long-term care facilities and residential facilities and working with folks in residential care. We provided the $300 stipend for them a few weeks ago. We also did a first responder hazard pay, if you will, stipend for folks like firefighters, law enforcement, EMS, corrections. And today because we kind of over budgeted, if you will, those programs, it doesn't require any additional dollars. But we are announcing that additional Medicaid staff in many of those facilities, maybe they're contract staff or staff that frankly we just didn't account for in the original calculation. Additional correction staff also that we overlooked a little bit in the initial calculation. We wanted to make sure that they were accounted for because they work side by side along with their peers in the exact same hazards and situations where they have to be called upon in an emergency situation. And then protective service workers, juvenile protective service workers, DCYF frontline workers, adult protective workers, juvenile probation and parole, all those workers that again are as those programs really ramp up and require that one-on-one contact with individuals from a protective service standpoint. We cannot provide stipends to every business and every operation in the state. We obviously wish we could. That would be a tremendous opportunity, but we are continuing to prioritize those needs, fill in those gaps, and be able to provide those enhancements to help ensure that the workforce will be there for some of our most critical and most dangerous positions as we go through the COVID-19 crisis. Finally, we just have a slide here, and I appreciate everyone bearing with the presentation. But we do have a slide here just looking at the future. So on the left, you see a pie chart that looks at what we've spent previous to today, $250 million allocated, another $595 million that has been allocated as part of today's announcement and these new relief funds we're talking about. And that still leaves us well over $400 million, on the back end. And that can be to support any of the existing programs we've talked about today if we want to put additional dollars into those programs if that need should arise. We've talked a lot about housing and homelessness. What else we may need to do down the road for K-12 education, private higher education. We put some money today into our university system, UNH, Plymouth, Keene, Granite State College, as well as the community college system we have here. But there's also a lot of private higher education needs that might be out there, and we're going to continue to work with them and see if we can, make sure that they have resources they need to combat the COVID-19 epidemic as they design their plans to bring their students back in as well. And then again, that great word out there, other, right? The door's open. There's a lot of other programs and needs that maybe we've identified today, maybe we haven't. But with $400 million still left in the till, that gives us a lot of flexibility to address the needs and really make sure that we are coming at this with everything we have and making it as fast and as quick as we need to. Nearly every area today, again, that we discussed today did come from that bipartisan legislative advisory board. I want to again thank them. I want to thank the stakeholders that have continued to participate in the stakeholder board. Those jobs aren't done. They're going to keep meeting. They're going to keep discussing ways and ideas about how to best utilize the remaining funds. And obviously, the team at Gopher has a lot of work to do. They've done a lot of work, but a lot of work to do as well, and make sure that we're getting this help and relief exactly where we need to. I guess with that, we appreciate everyone's presentation. I'm always a visual person, and I know a lot of other folks are, so we wanted to be able to people understand where all this money was really going. We want to be transparent in everything we do, obviously, and we can open up for questions if people do.
There were some significant differences in what you're allocating in the amounts from what was discussed by the Legislative Advisory Committee. How did you arrive at the
So as I discussed, it's really about front-loading a lot of it. So the Legislative Advisory Committee, I think, was looking at multiple future allocations down the road in a few months and then a few months and then a few months. Because we do have till December 2020 to spend the dollars. What I've really taken is some of those programs, like the nonprofits, the business programs, taking some of those likely future allocations and really front-loading them into one program, so that to make sure that whatever we do for businesses, whatever we do for these nonprofits, we're getting the dollars out quickly and it can be impactful and allow them to pay those bills and provide the relief they need. We could do $100 million on business, but you're really just scratching the surface, and we know the need is there. So the thought was we heard from businesses and we talked to some folks on the Legislative Advisory Board, and they all agreed that if there's a possibility to get it out now, we're probably at that apex of economic need. We want to move quickly. We don't want to, why hold the dollars? They're not our dollars. They're your dollars. They're taxpayer dollars designed to provide relief. So we want to get them out as fast as we can.
Unless I have it wrong, you're recommending half the level of allotments to hospitals that they suggested. Why is that?
Well, because if you noticed, because we're accounting for the hundreds and hundreds and hundreds of millions of dollars that the federal government is providing. So they're providing nearly $500 million of relief, at least. About $250 million's already come in. We anticipate at least another $250 million, $400 million maybe, who knows? Depends how the federal government looks at their formula. Will still come in, plus stimulus money. So our fund was designed to really make sure that hospitals didn't just get a check, but those healthcare facilities had the funds to keep doors open. With the $500 million that is, some of which is coming in and still coming in, that's going to provide a lot of the cash relief that I think originally the LAB was looking to provide for these hospitals. So there's a lot of hospital and healthcare relief out there. It is not enough to fill every hole. Hospitals are not going to be made whole per se. I don't think anybody is. There's going to be tightening of the belt on everybody's part through this. But nobody's shutting their doors. That's our job. We're going to make sure nobody has to shut their doors. Federal government's coming in with a lot of the additional cash. I mean, $500 million is more than we ever could have. A lot more than the $100 million that was originally anticipated for these programs. And we can still put more in. We can always put more in down the road. We have a reserve account.
These recommendations, you could just describe the process by which, you and who else were pondering the best allocations for this money.
Sure. So they submitted recommendations. I have Director Little here, maybe Monday, Tuesday? Was it Monday? They submitted, I think they took a vote.
And what did you do with those recommendations? You looked at them and
I looked at them and walked right over to the Gopher team, and we sat down for a few hours and over a period of a couple of days. We had a lot of phone calls, understood what federal dollars might come in for these programs, discuss some of the concepts that had been brought. If we're going to do something for nonprofits, deciding the amount is one thing. I don't want to say that's the easy part, but that's just a piece of the puzzle. Then how do you get it out? Who's going to be the administrator of it? And we really looked in detail at the proposal given to us by the Charitable Foundation, CDFA, and the Center for Nonprofits, and it was a very good presentation. It really was, and we said, okay, this will work. We might make a couple tweaks to it here and there, or they may have to do that as well. No program like this has ever really happened, but to have those three organizations come together, we cannot thank them enough. And then we went to the next one. We talked about the presentation with agriculture. We talked about all of those things. So I was not directly involved with the LAB meetings or the stakeholder meetings. We really kept a part of that, let them do their job. Then we took it, and over the past 3 or 4 days, just really started crunching it out, and the team at the Gopher is just phenomenal. And we talked about all the different possibilities and opportunities to do this in a fast, streamlined way and a fair way. Fair is the most important thing. Not that the PPP program provided a lot of economic support. I don't want to say it wasn't fair, but it was a first-come, first-served program. It ran out of money. So we said, how do we do that in New Hampshire where everyone who qualifies should get something? right? And it's not necessarily 100% of their losses or even 50% of their losses, but something. If a business maybe loses $150,000, can we get them $5,000, $10,000, $15,000 so they can pay their mortgage, their bills, stay alive, if you will, pay their property taxes so they don't have liens, get that money back into the economy? And that's some of the ideas we batted around, and there were great discussions. But really, I leaned a lot on the team at Gopher. I think they did a tremendous job.
What, if any, independent oversight will there be of the Main Street Relief Fund? And how do you decide who gets paid first? And then also,
everyone gets paid at the same time. That's the beauty of the fund. In theory, we design a formula. Everyone gets their fair pro rata share.
when will the public know who gets what?
We'll have a 2-week, what we're really doing is over the next 2 weeks, you fill out your pre-grant application. We'll get a sense of all those who qualify, what the need within those qualifications are. We're really excluding big business here. This is not for big business. It's not. It's for Main Street businesses. It's for the mid-size and smaller businesses, some of which may have received PPP funding, and that'll be accounted for. If you've received some funding, that'll be accounted for in the formula, or other federal funding, of course. But we find out what the need is within those qualifications within 2 weeks. We'll probably have to, by law, we have to have a separate, a very simple technical final grant application. So everyone who applied first, they come back in and apply the second time. Very simple, checks go out. It's really that, I mean, that's the beauty of what has been set up here. We've really simplified it to be fair, and again, everyone who gets a check, we're going to make sure that everyone in the state can see it. It's all public information. If you want to receive a check and you don't want to be out in the public, this isn't for you, because it's all going to be transparent and in public. And these guys did a great job setting up a system. I don't know of any other like it in the country. I know some other governors have talked about how they're going to distribute small business relief. Some governors are just cutting checks to every business they can find in arbitrary amounts, whether there's a need or not. That's fine. That's for them. We dug a little deeper, and I think we came up with a really creative, very elegant way to do it simply and fair.
And who decides who qualifies ultimately, DRA or your office?
So the qualifications, the overall qualifications are really preset as to small businesses, less than $20 million. If you're self-employed, you likely won't qualify, because if you are facing hardship, you could get unemployment insurance, right? You could just get, because I expanded the unemployment insurance to finally allow for self-employed, so they probably wouldn't qualify. A lot of the franchises, we're not here to do franchises, that won't necessarily qualify, and we ask those questions as part of it. We look at what you've made, what you think you're going to lose. We make some adjustments, and then everyone gets a share.
Governor, I know you're concerned about cities and towns and property taxpayers. If a business gets a grant, are they required to use that money to pay property taxes if they haven't? In other words, can they get a grant and still not pay their property taxes?
So businesses that will get a grant are only businesses that have experienced significant loss, right? There's also, there'll be some thresholds that we set, and those might be, I don't know exactly what they'll be, but I can tell you, you have to have lost money. You have to have some significant loss there. And they will have the flexibility in determining how to spend those dollars. If you got to trust that if these businesses that are predetermined to have loss, it wouldn't make any sense for them to necessarily put it in their pocket. They got to pay their bills if they want the business to survive. So I know we're giving the businesses the flexibility, but nobody wants a lien and no one wants to be foreclosed on. As someone who used to run businesses, I can tell you, if I was given any extra money, that's what you pay first. You pay your biggest bills first, the ones that can be most impactful, and the ones that can affect whether you open down the road or not and affect your cash flow. So you have to trust the businesses at least a little bit in terms of how they're going to spend it, but it will only be given to businesses that have experienced significant loss. So that's kind of the guidepost, if you will, that we've set up to ensure that.
Now, were you looking at, I think at one point there was some discussion, I guess, internally about forgivable loans.
Yeah, these are grants.
These are grants?
These are grants. You know, the forgivable loan process through PPP is interesting.
Yeah.
You know, I think it creates more anxiety for business. You can't just ask businesses to keep borrowing and borrowing and borrowing. As somebody in business, I can tell you they'll end up borrowing themselves into oblivion. They can do it, but it's not viable. It's really just short term, because ultimately if they cannot pay that back, if they don't meet those covenants, and you don't know what the situation is going to be. I can tell you, again, I think the PPP program provided a lot of opportunity, but there is a lot of anxiety on businesses on whether they're going to be able to meet the covenants and whether their $200,000 forgivable loan will truly become a grant or a loan. That's a big difference in the world of a business. We don't want to create that anxiety for folks. These are grants. This money is designed to go out, get the relief exactly where it needs to go.
Governor, how
will you divvy up the healthcare money to facilities and long-term care facilities? Will that be dispersed evenly or depending
Yeah.
on they've been impacted by
Really the
COVID?
same way we're doing it now. So again, we have an independent committee that looks at the areas of highest need. Where again, it's all designed. You might be sick of hearing me say it, but I just want to reiterate, it's very important. Our fund is designed so no one closes their doors. So if a long-term care facility, as part of this process, were to come and say, hey, we're not going to be around in 3 or 4 months. We're going to have to shut our doors and all our residents are going to have to go to hospitals or back to homes or whatever it is. That would be a very terrible situation. That's what this is designed for. We want to be able to then move them to the front of the line, score them appropriately, and get, you give the folks that need to be prioritized priority placement.
What if you get a lot of facilities that say we are close to shutting our doors?
Mhm.
Can you move money from other funds?
That's why I have $400 million of unspent and unallocated funds. And that's exactly what we would potentially use them for. Or hospitals, long-term care facilities, or whatever. Businesses, maybe we need a little more into the business fund, whatever it might be. But that's a flexible $400 million on the back end. I think the Legislative Advisory Board, and even myself as well, was going down the path of thinking, okay, we'll keep a lot of this on the back end. But again, we want to front load it as much as we can for nonprofits and businesses, but still have enough on the back end. So if we need to supplement down the road, we can definitely do it.
In terms of the antibody testing, can we hear from you and Commissioner Shibinette about your interpretations of what you've seen in the data so far from the antibody testing?
Sure. I'll leave it to the Commissioner.
So we're experiencing a pretty low rate of positivity with our antibody testing. So our total antibody testing to date is 3,913 tests. That includes today. I don't have it broken out yet. So that's total going back to when it first came out. So we're seeing a pretty low percentage of positivity with our antibody testing. Like I said, we've done contact tracing on and case investigations on all of anybody that's got positive antibodies, trying to trace it back to, have they infected anyone else? Is it singularly in a community? And we haven't seen any patterns. And honestly, I don't know that we have enough positives at this point that we would see the pattern yet anyways. I think that's still a couple weeks out.
So what sort of guidance do people who receive a positive antibody test get on their safety and, should they take that they can go and, live a less socially restricted life?
Sure. So it really depends on the case investigation. So, public health officials will tell you that it takes 14 days from your infection to develop antibodies, which is typically the time where you would be coming off isolation or quarantine if you had symptoms. So if the person can identify the time period in which they were sick, we will do a case investigation on that. We'll base our decisions on quarantine isolation are really around what they're telling us, but the vast majority of positive people are considered recovered. I mean, they're coming in at a point where the presence of illness is just not present anymore. So when they do the case investigation, they're not symptomatic. It's been several weeks since they had symptoms, or they may not have even realized that they had symptoms. So the majority of those positive cases are considered recovered by the time they have that antibody test.
So do you know what percentage of the testing that we've done has been carried out on the Abbott machines, given the FDA's concerns on potentially false negatives of up to 15 to 20%?
Very small amount. I don't have a percentage, but I can find out those per. Though the Abbott machine test, because it's only one sample at a time, right? So it's not like you can do hundreds of samples. So our CST team, for example, has an Abbott machine on their truck. They average about 25 tests a day when they're out. So we have other Abbott machines. They have actually 2 Abbott machines on that truck, and they average 25 tests a day. We have an Abbott machine in our public health lab to do stat tests, and then we have them at various hospitals. We did learn of the FDA guidance recently, and we are having those conversations internally about how can we ensure. So if you have an Abbott ID test that comes out positive, you're good to go. I mean, that's a good test. But if you have it negative, there is discussion on whether we should be pulling 2 samples, one for the Abbott ID, and if that's negative, and then sending the second sample in for a PCR. And I think you'll see that is probably consistent across the states when they look at that guidance. That'll be the the way to fix that is to pull 2 samples.
Now, Commissioner, with regard to back to antibodies, just for a second, the few that come positive, are those recorded as a new positive case of COVID?
No.
Yeah,
No,
okay.
nope. The positive cases that we report to you every day are confirmed cases. Anybody that has a positive antibody test is considered a probable case and not a confirmed case.
Governor, on the, as we've been doing these, you've really kind of tried to keep a hands-off approach when it comes to enforcement. You're saying you don't want to take a heavy hand, I guess, and do
Sure.
those things. As we've been out and about speaking to more local level law enforcement, we're hearing from some, like the police chief in Lincoln, who, this is a quote, he says, on the local level, we'll be enforcing, he's talking about the guidance,
Yeah.
we'll be enforcing to the town of Lincoln, it's a misdemeanor charge and it carries up to a $20,000 fine. Is the Attorney General's office saying, enforce the law to our local police departments when it comes to this guidance?
Well, we always want to enforce the law. I think if, again, what we've, and I don't want to speak for the Attorney General, but my sense is the Attorney General's discussions with all law enforcement across the state is to remind them that we're in unprecedented times when you can be flexible. Sometimes people are unintentionally breaking the guidance. That we don't expect 1.35 million people to have read every bit of guidance that we've put out. We've put out a lot of it, of course, and so we want to be cognizant of that. This is all very new to individuals, and that's simply what we've asked of the local law enforcement. Now, the law is the law, and they can enforce it, as it is defined and written. But we always want to give people kind of that chance to understand, what's going on, why there might be an infraction. I was going to say we've all gotten warnings instead of speeding. I have. I don't know. Maybe you're 65. I know you, Adam. You're very, very careful about staying to the speed limit. But no. I mean, when you can give someone a warning when people aren't intentionally trying to thwart things and they're just trying to do right. I mean, you don't necessarily have to come down with a heavy hand. If other individuals are just, really thumbing their nose at the law, well, then of course. But there's all, I think our law enforcement across the state, from local to state police, does a great job of having a good, personal one-on-one manner with individuals, and they know how to approach the situation. We trust that. Have some folks on the phone?
Next question comes from Kathy McCormick with Associated Press. Kathy, go ahead with your question.
Yes, thank you. New Hampshire has released the names and addresses of people who test positive for the virus to law enforcement and other first responders. What is the state doing to monitor how this data is being used? And how do you know it is providing a benefit to first responders?
Sure. You want to take that?
Sure.
I'll
Thank you. This is Commissioner Shibinette to answer that question. We did execute memorandums of understanding with our towns and cities that had access to that information. That MOU between the state and those towns and cities spell out what they can use and what they cannot use that information for. Early on, when we began this project, we did hear stories, very few, of it maybe not being used exactly the way it was intended. We made some personal phone calls to those towns and cities. Usually it was a misunderstanding. As far as we know, no protected health information was ever released. We get information from towns and cities about. Most of it is individual stories, and I received one just this morning from a police chief and a fire chief that was able to get information from dispatch that the person or the house that they were responding to had a COVID positive person, and it allowed their entire team to get inappropriate PPE before entering the house, and it made a huge difference because outside of that notification, they would have not known that person had a positive PPE test. And what we have, before we started this process, what would typically happen is an ambulance crew or fire department, police department would respond to a scene, have interaction and close contact with a person, and at times would result in the quarantining of 5, 6, 10 people at a time because they came in close contact with a person that had COVID-19 and that wasn't given to them. So there were points where we had 6 and 10 and 12 people from our first responders out on quarantine status. This really assisted them with being able to have that information and being able to protect themselves on the front lines.
Great, thank you, Commissioner.
The next question comes from Paula Tracy with In-Depth. Paula, go ahead with your question.
Yes, good afternoon. I have 3 questions. One relates to nursing homes, another one to outdoor wedding venues, and a third to summer camps. And I'm told that healthcare experts say that nursing home workers should be tested daily. Is that happening? And if not, why? And is it possible that some of the money that you just announced could be available for housing of workers to keep them sort of outside their home if they chose? And then the second question is about outdoor weddings. Could those venues go forward under restaurant guidelines in phase 1 so that the brides can still have their day?
So, yeah,
And then
oh,
the
sorry.
third, and the third question is about overnight summer camp. I know you haven't made a decision on this, and I know you were a camper once and know what that whole scene is all about. You know, the going to the bathroom in the middle of the night with all the flies flying around and all the kids playing around and eating, you know, and bug juice, all that. Is guidance on the way for these summer camps? And that'll conclude my list.
Okay. If you don't mind, I'm going to answer the second 2 questions first, and then I'll ask the Commissioner to come up and talk about the long-term care facilities and the opportunities there. So we have gotten a lot of requests, and obviously it is wedding season. It's summer. It's always wedding season, I guess, in New Hampshire. And we know there's a lot of our desire to figure out exactly if and how weddings can be done. We know there's a lot of money tied up in contracts. Folks have put deposits down. I spoke with Ben Chan about both of these issues last night. We don't have guidance as of yet. At some point, it is very possible, to your question, that we allow weddings to move forward in a similar fashion that we've done restaurants. Now, the weddings is also 2 facets. There's the ceremony, and then there's the reception. And so those are also 2 very different things that may have very different guidance. The reception is obviously a party. So if you get to the point where you're now allowing folks to have a party and whatnot, you really have to take a lot of that the social interaction of individuals as part of that part of the festivities in hand, and they may have their own guidance. But as far as the ceremony is concerned, that may have its own guidance. But we are working. We know people are being very patient. We're just in the opening days here of getting things going. It's May. I know people have to make long-term plans and decisions. Unfortunately, we're just not there where we can, with any confidence, say definitively this is going to be the guidance for those areas. Same with summer camps. Very challenging situation. We've looked at the opportunities for doing summer camps, whether it's just for New Hampshire residents, whether you test all the campers coming in, maybe you have a regular testing opportunity for those campers in some facet, and daily screenings or temperature checks. All of this is really being batted around as opportunities to try to get to yes, to try to get to the opportunity. We are not there yet. We're really not, and I think Dr. Chan and his team have done a tremendous job reading through and being very detailed with all the different guidance. Remember, we're looking at dozens and dozens of different pieces of guidance documents just over the last few weeks, and using their best judgment to, again, allow certain things to go forward, but also we all have to appreciate we're going to have to look at data, right? And the data, for example, of how we opened up retail facilities or the outdoor seating of restaurants, which hasn't even started yet. It'll start on Monday. Well, it'll take a couple weeks to really understand what the impact of that decision was. And did we create small clusters? Do we unintentionally create a situation where the spread of the virus is rising? And even if that were the case, is it still something that we can manage long term? Is it something that the healthcare system could manage? Who are those affected? So all of those are, I apologize for the long answer, but all those are really important pieces of data that will come as we take these first steps, and it is going to be steps. We appreciate the desire for folks. I get a requests on a daily basis about the weddings, and that's a very tough situation. We're not there yet. We are moving as fast as we possibly can and as safe as we possibly can to get folks the answers that they're looking for.
Date on the summer camp front?
I'm sorry?
Do you have a date on the summer camp front? Where
No,
you-
not yet. The question is, do I have a date on the summer camp front? We're looking at both day camps and overnight camps. Remember, those two are they're so different. Day camps provide a tremendous opportunity for the kids to come in. They're not as clustered together sometimes, but they do go back to the community every single day. So it's very hard to monitor them on a daily and consistent basis. Summer camps are more clustered. There's overnight, there's cabins, things of that nature. But they also in a sense, in their own little world. So that also provides different opportunities and challenges. So with that, I'm going to turn it over to the commissioner to deal with to talk about the long term.
Thank you. So daily testing in long-term care, that would be ideal. I would agree that would be an ideal situation where we could test every person as they were coming in. That would allow us to open up our facilities to visitors and families and everything again if we had a test like that. But as of right now, I don't believe a test like that exists. The closest we would have to that would be an Abbott, as of the most recent guidance, it does appear that we will be doing some backup testing around some of the Abbott swabs, but even the Abbott takes 15 to 17 minutes. And if you think about that, if a facility has 300 people coming to work at 7 a.m., you would spend the entire day testing people before they came to work. So ideally, yes, I would love to see daily testing, although I don't understand how we could do it at this point. When you look at the healthcare workforce in long-term care, approximate numbers, 10,000 in the state of New Hampshire right now. So I'm not sure that the technology has caught up with that need at this point. What we are doing is testing all of our healthcare workers to do a baseline, which we are in progress of doing that right now, and then creating a Sentinel surveillance project where we test a percentage of the workforce every week. What we find when we go into a facility is if you have one positive staff member, you probably have more than one positive staff member. So, doing a percentage of your staff and a different percentage every week is going to be very helpful. That surveillance project is still being written. We'll be doing a Sentinel surveillance project both on resident testing after we do our baseline testing on every resident, and we'll be doing a Sentinel surveillance project on staff. Our hope is that we're going to test the vast majority of all staff every 10 days. But one of the ways that we hope to accomplish that is as we stand up more fixed sites, testing sites, and we will be standing up more fixed testing sites, more to come on that next week, leaving those sites open and accessible to those healthcare workers on an ongoing basis every day. And that may look like every healthcare facility being assigned a fixed site and say, on Tuesday every week, you get to send your staff there to get tested. And so we're bouncing around a lot of those ideas on how to accomplish testing for long-term care staff as frequently as we possibly can manage in this state.
Just a quick follow-up on the Abbott machines. So it's fair to say that the state is looking at how to address the concerns of the FDA, either by retesting, phasing these machines out. Because obviously when these machines were announced, this was something that there was frustration over the lack of supplies, but it was seen as something that was going to be really beneficial.
Yeah, I don't think we're going to phase them out. I mean, the Abbott machine requires a lab environment to use. So, when we first got the Abbott, there was a lot of talk about, well, let's put them in every lobby of every nursing home. And when we got the Abbott and we figured out that we couldn't do that because it requires a biosafety cabinet to be able to run a test, most of which no nursing home has, the only place that they were placed is either in our mobile lab, in our current public health lab, or in hospital labs, all who of which has the ability to run a second test. So as a quick test to see positive, negative, Abbott can certainly be used to test for an easy positive, but then, right now we have to develop our guidance around what's the next step after you get a negative, because based on the FDA guidance, there's going to be a next step.
The next question comes from Michael Graham with New Hampshire Journal. Michael, go ahead with your question.
A quick data question for Commissioner Shibinette. is the number of people under the age of 60 without comorbidities who died from COVID still 0? And the question for Governor Sununu is, from Delaware to Maine, states are reopening their beaches, including New Jersey, which has a plan, despite the fact that they, like New Hampshire, share a border with a state that has a COVID hotspot. Under what conditions will you allow New Hampshire to reopen its beaches?
So the answer to the first question is yes, it is still 0 for the under 60 morbidity fatalities. The question, I think the second part of your question really revolves around what we're looking at in terms of beaches. We're not looking at New Jersey, I can tell you that. That has no bearing on New Hampshire whatsoever. We are looking at our neighbors around New England, whether it be Massachusetts and Maine, and looking at the guidance that was presented as part of the Hampton Beach Commission, and the folks, I should say, the folks that came from Hampton Beach that really helped lead the charge for the entire Seacoast. They did a tremendous job. But we're definitely not there yet. We'll keep looking at what possibilities may be there. I think it was a very good presentation. But again, we haven't even opened up open air seating in restaurants yet. Never mind, opening up a Hampton Beach to 100,000 people, mostly out-of-staters, right? So from Massachusetts, which you've heard me say it 100 times, but traditionally we would love to have them here, but not now. The stay-at-home provisions really still apply to New Hampshire and Massachusetts, and we want them to be healthier at home in Massachusetts as well. So we'll continue to monitor and work with our partners in other states and try to find a pathway forward, but we're just not there yet.
The next question comes from Tony Shanella with Patch. Tony, go ahead with your question.
Oh, thank you very much. Two quick ones, Governor. Are there any plans to coordinate or connect farms, the Agriculture Commission, the food bank, New Hampshire Food Bank, and or local stores to get our farmers' products or more of them to consumers? As an example, at Market Basket this morning in Concord, as well as the Aldi, there were shortages again of meat, pork and poultry products, as well as fresh vegetables. So if there's any coordination, that would be good to find out. And then the second thing is, can you just take a minute and comment about some of the discourse in the public sphere right now concerning there not being enough testing, requests to force people wear masks, the modeling by the IHME, which has previously been shown to be wildly wrong on the cumulative hospital rates and projected fatalities. All of these things appear to be used as political weapons right now and potentially could be needlessly scaring a lot of people in the state. Can you talk about that?
Sure.
As well, please?
Yep, sure. I apologize. Let's do the first. I don't mean to make you repeat it. Could you just give me the first question again, and then I'll take each of those sub-issues in your second, 2A, B, and C separately as well. Sorry. What was the first piece?
Sure. So the first one is just about connecting.
Oh, the farmers. Yes. Yep. Thank you.
The food bank, if they need food, right, and there's been a bunch of reports of people just throwing vegetables away and things like that across the country. So what kind of coordination?
So again, so today we're announced $15 million for farms and food is what we're calling it, which is specifically designed around the Department of Agriculture and farmers and the food bank, exactly what you're referring to. And again, not just providing relief, but making those connections. The Department of Agriculture, I think, already does and here in New Hampshire, we have a great connection with our local farmers and the opportunities, local grocery stores, the opportunities with food banks. And so, anything we do to maximize that, putting those resources to bear to help maximize those connections to make sure there isn't waste where there is need is going to be very, very important. Secondly, you asked about all those different things, whether it's the politicizing the lack of testing. Look, we did over 2,500 tests yesterday, so a lack of testing is not a valid concern right now in that we know we want more, but we've really ramped it up. Just over the past week or so, we've almost doubled the number of tests. In the past 2 or 3 weeks, we've quadrupled and gone up 5 times in some cases. So the team is doing a great job constantly increasing testing, making sure that effectively almost anybody who wants a test is getting a test. So that's phenomenal. And also making sure at the same time we're prioritizing long-term care facilities. The use of masks, again, Massachusetts has mandated the use of masks. We're not at that point here in the state. If local cities and towns can do that and want to go down that path, it is their choice to do so. Again, but as a state, I don't feel it's necessary to do that across the state at this time. But they have the choice to do so. You have to be careful there because as one of the initial questions came up was about enforcement. look, I don't see any of these issues as political. I don't understand the politics in any of that, and so we just take all of these issues, whether it's PPE or testing or what's going in long-term care facilities. I'm not sure how any of that is political at all. So we just kind of put our heads down, look at the data, and do our job. And I'm blessed to be surrounded by a great team.
The next question comes from Harrison Thorpe with the Rochester Voice. Harrison, go ahead with your question.
Yeah, thank you. I have one for Commissioner Shibinette and one for the governor. I see the death rate is now at 4% for the confirmed cases, but can you tell us what the percentage would be if you took out all those deaths in elderly congregate living facilities, and do you have that death rate throughout the state outside those facilities, especially where they had outbreaks? So just the general death rate outside those facilities. And for the governor, regarding Monday's dine-out rules, I can understand why the state doesn't want to allow live music such as bands, but everyone knows to practice social distancing, so why are the restaurants prohibited from just having some music piped in? Thank you.
So I'll actually take the first question. I'm just going to do basic math. Roughly, unfortunately, about 75%, I'm ballparking that a little bit, about 75% of the fatalities have come through long-term care facilities in the state. The overall death rate is about 4%. So therefore, about 1/4 of that, 25%, is due to fatalities outside of those facilities. So I'm going to take 4%, multiply it by 1/4, and I get about a 1% fatality rate outside those facilities. So I'm just doing very rough math there, but that's approximately what it is. The second question, sorry, is why can't they have bands or ancillary? I think the idea was just to get the focus wasn't, to be honest, when we created our guidance, we wanted to make sure that we provided the opportunity for citizens. We provided the opportunity for those restaurants to do that outdoor seating with the physical distancing and whatnot. We really didn't want to get into the game of saying, well, you can have that band because it has a certain amount of people on there, and you can have, but you can't have it because that stage is too small, and you can have. We didn't want to get into kind of picking and choosing all the different aspects of the additional. It might be a band or music. It could be other things too. It could be a variety of other things that a restaurant typically provides as part of their ambiance and atmosphere. We don't want to get into the position of picking winners and losers and why one would be okay and why one wouldn't. We simply said across the board, let's just focus on getting up and running, providing that dining out experience and dining out because you're literally outside, and then we'll can take additional steps down the road. Great. I think my math was right there. I don't know. I'm sure someone is tweeting that I did bad math there, but I think we're pretty accurate.
Before we go, There was a lot of talk in the last few weeks about the hospitalization rate and what that was telling us, the number of deaths over the last few weeks. Can we hear from Commissioner Shibinette or yourself about what we're seeing in those numbers now and sort of what it looks like in terms of where we are in the pandemic?
Oh, sure. I think it's fairly steady, but I'll let the Commissioner answer.
So our hospitalization rate is still right around 10%, which is good. We're watching our case numbers go up and our hospitalization numbers go down. There were points where our hospitalization rate was about 16 or 17%. The overall current hospitalization is a little bit higher, and as I explained on Wednesday, a lot of that has to do with length of stay rather than new hospitalizations, because we have people that are in hospital beds that are waiting on negative tests to get into facilities and things like that. The death rate, unfortunately, we're still seeing predominantly in our long-term care facilities, and that is not unexpected, but it is still tragic. What you'll see coming into next week, and I'm very hopeful over this weekend, we have 6 or 7 facilities that are at day 12 and 13 of their outbreak of having no new activity, which means early next week or over the weekend we would close 5, 6, 7 of those outbreaks, and we're really, really hopeful that that's going to happen next week, because it just gives us a little bit of breathing room. At the same time, we have new ones crop up every now and then. Our testing going up, our testing capacity continues to elevate. Standing up statewide testing for thousands of people every day is no easy task, and we've done that in a couple of weeks, and we're still working out the hiccups. We're going to stand up additional fixed sites for sure. We have some fixed sites that have very high no-show rates or cancellation rates. So then, we have to start talking about, should we, double book every appointment or book extra appointments at so often during the day? Because when you have, when you're completely booked out for appointments and you got a 30 or 40% no-show rate, it really interrupts the flow of testing. So really looking at our data, because we have about a full week of really good data now, looking at our data on how we can tweak every one of those systems to really make it work as efficiently and effectively as possible.
Great. Thank you.
Is this a deadline day for the declaration? Are you, or is it coming this weekend?
The emergency or the emergency order?
Yeah.
Should I sign it again, do you think? Yes, it is a deadline day. So every 21 days I do have to re-up the emergency order, and I did re-up that earlier today. Thank you for reminding me.
And on Monday, as you know, Governor Baker of Massachusetts is going to announce the first kind of reopening in that state. And you've got a number of new guidances before you passive attractions, lodging. Could you talk a little bit about the impact of how things go with this reopening in Massachusetts?
Yeah.
Does that affect how you might look at it phase two?
Yeah, sure. I think it might, at least in some areas of our economy. Obviously, we always talk about the beaches and how that affects, or travel and tourism. I spoke with the Governor Baker last night. We didn't talk about any of the specific details of his plan per se, but we talked about some of the aspects of ours and what had worked. We talked with a variety of governors on a larger call, and we're all kind of sharing ideas. So I'm interested to see what's there and how they do it. Every state is releasing they're not just opening things up at a different rate, but depending on their everything from socioeconomic demographics to their proximity to hotspots, to travel and tourism, to what their key areas of manufacturing or their economy are. Everyone's choosing a different path. Some are taking it very stepwise as we are. Some are coming out with one robust plan that says, today we're opening here, and in a month we're going to open there. We're going to be a little more data-centric than just a grandiose plan like that, because, again, we want to be nimble. We have the ability to do that. We're a smaller state, and we can be nimble. And I think we need to, because, to the point of your question, we are so connected to what's going on in Massachusetts. So being nimble is a very important thing. But I'm very interested to see what they're looking at. They have very different laws and rules in their state too. Their beaches, a lot of their beaches are, the majority of their beaches, I believe, are controlled by towns, and so the towns will have a lot of choice in terms of how to do that, and how that impacts the governor's decision and his administration's decision to open things up and not. It'll be interesting to see and understand that a little more, and then we'll just that's just another variable that we look at. We're very data driven, and we'll keep kind of reassessing and moving forward. But we are going to take this step at a time. We really are. We're not going to be pushed into anything. Just because Massachusetts, if they were open all their beaches tomorrow, it doesn't mean we open the next day. That's just not the way it's going to work. But it allows us to appreciate and maybe even watch what happens down there, see the data, see the impacts, and make, I think, better assessment and better judgments for ourselves. But we're constantly talking to other states. We're constantly looking at their data. The one thing I'll caution is that some states have said, well, these states have opened everything up, and they haven't seen any increase in their numbers yet. Well, of course they haven't. It just happened like a week ago. So even if people were getting infected, you probably wouldn't be symptomatic until around this week. You may not get the results and be tested until next week or whatever it might be. So even those early states, you're only going to start seeing data around now if there were a negative causality there. So we'll watch those states as well. We'll watch what they've done and what the impacts are. And not being first out of the gate, we don't want to be last per se, but we're going to do what we have to do at our level. But not being first out of the gate gives us the advantage of using other states' data to better inform our decisions as well.
One last quick one under the gun here.
I think we're breaking a record, by the way. This is almost as long as my inauguration speech.
Somebody asking about the outlook for a potential shortened Little League season, potentially in the next couple of months. Someone's
asking about the Little League season? Yeah. A lot of people are asking about the Little League season. So I talked to Dr. Chen about that last night as well. So we're one idea is if you look at just all sports together, not just Little League, but all sports, it becomes much more difficult because there's different instances of contact. There's different indoor versus outdoor. I can tell you, I think it's safe to say indoor sports with tight locker rooms, really tough to say yes to right now for obvious reasons. Outdoor sports with minimal contact like baseball, maybe a little more flexibility there to be sure. So we are looking at it. I'd love to get whether it's a shortened season or an extended season, whatever it is, on the back end going. That would be wonderful. But we're looking at all of that. And Dr. Chan and his team are going to look at the data and what other states have seen. And there's been some pretty innovative ideas. Maybe just starting things with non-contact, small incident practices and something like that in July, August, September. Who knows? We're just not there to make any definitive answers yet. But we are trying. I mean, we really, really are. Nobody is sitting back saying, well, we'll just wait longer just because we can. Nobody wants that. Anything we can get going in a safe way, we're getting going on because it impacts lives, the economy, mental health. Kids don't want to be inside and at their home just all day. They want to go play sports. They want to integrate with their friends, and that's a very important part of being healthy, right? We appreciate that. So we're moving as fast as we possibly can, but we got to take these steps. And I think that the way we've designed our process is the right process for New Hampshire at this time. So last thing, and we're going to go, and I appreciate everyone sticking with us for those who have. Director Little, he's not here too often. I'm going to put him completely on the spot. I didn't ask him to say anything. Who's just done, here, come on up. He's done a terrific job managing the entire Gopher process and the team, and they're going to continue to do so. Didn't know if you wanted to add anything.
Yeah, thank you, Governor. The Governor did a phenomenal job explaining the additional programs that have been added today. There's nothing I can really add to that, but what I do want to say is thank you to the Gopher team. It's 10 other people besides myself who have essentially been in a bunker for the last month, working very long days, nights, weekends, and churning out an amazing amount of high-quality work. And I have a lot of gratitude for the commitment and the effort that they have put into it. It's been a fascinating process, and I'm just honored and pleased to have an opportunity to work beside them. It's been very great and good, and I'm honored to have been asked to do it, Governor. Thank you. And we're looking forward to doing some more of it as we move through the year.
Great.
Thank you.
Thank you, guys. All right. Thank you, guys. Thank you very much. Everyone have a great weekend. It's Memorial Day weekend. No days off, I guess, for some of us. But have a great Memorial Day. And next week is Memorial Day, right? Yeah. See, I don't even know what date it is. That's how little sleep I'm getting. But have a great weekend. Anyways, we'll see you on Monday. Thank you guys so much.